If you think delegation means being lazy as a nurse, you're already failing the NCLEX. Because delegation is not about helping, it's about survival. Your survival and your patient's survival. Today, I will show you why most nursing students delegate wrong, how NCLEX traps you with delegation questions, and how real registered nurses think, not students. Delegation is one of the top reasons students fail NCLEX questions, not because it is difficult, but because it looks easy. Students think emotionally. NCLEX thinks legally, and patients suffer in between. Let's be clear, delegation is not teamwork. It is not helping, and it is definitely not being nice. Delegation is the transfer of a task, while the registered nurse keeps full accountability. You can delegate the task. You can never delegate the responsibility. If something goes wrong, the RN is liable, always. Here is the golden rule NCLEX loves. The registered nurse delegates tasks, not thinking. You never delegate assessment. You never delegate teaching. You never delegate evaluation. You never delegate clinical judgment. If the task requires a brain, the RN keeps it. Now, let's talk about who you can delegate to. NCLEX sees staff in a strict hierarchy. The registered nurse handles assessment, teaching, unstable patients, initial care, and decision-making. The licensed practical nurse handles stable patients, routine procedures, medications, depending on policy, and data collection, not interpretation. The unlicensed assistive personnel handle activities of daily living, vital signs for stable patients only, ambulation, and feeding, with no swallowing risk. NCLEX trap. It is not about experience. It is about scope of practice. Another trap students fall into. The UAP has 10 years of experience. NCLEX does not care. Scope is greater than experience. The patient looks fine. If the patient is newly admitted, postoperative, or changing, they are not stable. Students delegate to be kind. NCLEX delegates to be safe. Before you choose who to delegate to, ask yourself 4 questions. Is the patient stable? Is this a routine task? Does this task require judgment? Who has the legal authority to do it? If you answer these in order, the correct answer becomes obvious. Let's apply this to a real scenario. You are the registered nurse. You have 1 new admission, 1 postoperative patient, 1 stable patient needing vital signs, and 1 patient needing discharge teaching. The UAP gets stable vital signs. The RN handles admission and teaching. The LPN gives routine medications to a stable patient. NCLEX does not reward kindness. It rewards prioritization. Wrong delegation does not just fail exams. It kills patients. And it costs licenses. As a registered nurse, your job is not to do everything. Your job is to make sure everything is done safely. If you remember one thing from this video, remember this. Delegation is not about less work. It is about more responsibility. Think like a registered nurse, and NCLEX becomes predictable. Thanks for watching. If this video helped you think like a real registered nurse, subscribe and follow for more nursing content.